Good morning, everybody. Thank you all for joining us for our press briefing today. We are going to be talking about the release of our 21-22 business plan for the Department of Health and Human Services. So as you all know, one of the things that we have focused on is our mission, which is how we can create opportunities for more effective, more efficient, and customer-focused state government. And to be able to do that, we put together plans on how we deliver that higher level of service for our customers. And so today, we're going to be talking about our business plan for the Department of Health and Human Services. And I see we're also being joined by our division directors, Sherry Dawson from Behavioral Health, Kevin Bagley from Medicaid and Long-Term Care. We've got Dr. Antone from Public Health. Okay, I'm looking for Tony Green we got from Developmental Disabilities. And who am I missing?
Deputies from CFS represented.
Oh, where's Stephanie? Where's Stephanie Beasley?
She's in North Louisiana, North Nebraska, meeting and building capacity in North Nebraska.
She's in a meeting helping. All right, very good. So we got the assistants here too. So again, all of our different divisions in HHS are represented. And so all of them, of course, are going to be touched by the business plan here. And, you know, obviously we've been impacted by the pandemic. We didn't put out a 2021 plan because of the pandemic, but if you look at what we've been able to accomplish from the previous plan, we accomplished 92% of our goals from the last plan, and the ones that were not accomplished are continuing to be worked upon. And we've got a lot of great successes to talk about with the Department of Health and Human Services. I could not be more proud of how this department performed during the pandemic. If you think about all the things we were able to accomplish. I mean, think about getting the testing program set up and running so that we could provide testing through Test Nebraska, and how that essentially at one point doubled our testing capacity to be able to make sure we could find those folks who were testing positive for COVID. Or getting 1,000 of our teammates trained to be contact tracers, our own little Swiss Army, to be able to help out our public health departments in doing the contact tracing from so many, you know, that they had so many, really being overwhelmed, so many contacts they had to make. So our teammates being able to help out from that standpoint. Or getting people vaccinated, rolling out that vaccine program. And right now, I think we've got 89% of our seniors age 65 years and older have been vaccinated, which ranks us about number 14th in the country. So we're rolling out that vaccine program. So those are just some of the things that we can be very proud of the way this is the Department of Health and Human Services has worked to be able to keep people healthy over the course of this pandemic. But of course, it's not just the pandemic, it's all the other things the Department of Health and Human Services has done. I see Dr. Antone is here for Public Health. Not only did he do a great job in maintaining our relationships with the hospitals, but I believe the PDMP is under your purview as well, and how we're working with that to combat substance abuse. We also, talk about behavioral health, and Sherry Dawson, U.S. News & World's report ranks us the number 4th best state for mental health. And for example, one of the ways that we're helping with that is the SAMHSA grants, which you've been very successful in getting millions of dollars literally for the state to be able to work on a variety of different things. And also being able to help us start our addiction medicine fellowship with UNMC, which is a great thing. Medicaid long-term services, Kevin Bagley, we talk about our MCOs and how they've been performing. You know, they've got a contract goal to be able to process applications, 90% of the time in 15 days. We're getting 95% of them done in 10 days. And then with regard to getting the appeals done, they have 45 days. We're getting them done in 20 days, like 90% of the time done in 20 days. So great work there for Medicaid and long-term services, working with our MCOs to be able to provide that level of service. Talking about Children and Family Services in our SNAP Next Step program, being able to help about 40% of those families be able to get that next best job. And in fact, it's really life-changing if you think about it. Being able to provide a better job, if you look at the data for the families we've been able to help, it's increased their income $22,843. That's amazing. That's over $1,900 a month. That's life-changing. So, and about, I think, was it 60% of the families are no longer on SNAP? I mean, that's an amazing statistic. So, great success there. And then, of course, developmental disabilities. Almost had plans done. Great job, right? That's up on the website. It's all there. So we just got so much great success to be able to talk about. And then, of course, we need to build upon that success. And that's what our 21-22 business plan is about making sure that we are laying the foundation to be able to kind of continue to provide a great level of service and help Nebraskans live better lives, right? That's our mission. So I'm very excited to have Danette Smith here to be able to go through in more detail with regard to what that 21-22 business plan looks like and what our goals are going to be and how we're going to accomplish those goals in the upcoming year. And so with that, CEO Smith, I'm going to turn it over to you.
Thank you, Governor. Good morning to everyone, and thank you, Governor, for your continued support and leadership to me and my team. We are excited this morning about launching our business plan, Many Good Deeds, Helping People Live Better Lives. This document describes our accomplishments over the past year and is compilated of our rethinking and re-engineering how human services is delivered due to the pandemic COVID-19. Just 1 second. This year, for my team and as well as for myself, has been a year of growth and opportunity. I've seen my team be resilient, they've expanded, there's been significant progress, they have persevered, and there's been tenacity. Governor, I have had the opportunity to recruit top leaders from across Nebraska, but also across our great nation, to come to Nebraska to help me serve. So I'd like to, even though you've done it already, Governor, introduce to you my leadership team, and of course, Dr. Gary Anthon is here with us today, Kevin Bagley over Medicaid long-term care, Sherry Dawson is here as our division director over behavioral health, Tony Green is also here representing developmental disabilities, Child and Family Services, the deputy directors are here representing Stephanie Beasley, and I have an awesome, very strong operations team, and that includes Rochelle Campbell, it also includes John Mills, also Lori Snyder, and so I'm so glad to have all of the staff on my team. I could not do this presentation, though, without an acknowledgement to Rick Gray. Rick has been awesome in helping manage this process, keep us organized, doing the editing, doing the writing, and just managing us to get this done. And Rick, a special thank you to you. I also like to share some additional accomplishments for this year. You heard some from the governor, but I have some additional ones. There's a couple things that I thought that we did really special this year, and one of those things, we improved and enhanced communication and outreach to the community across the state. We've also embellished our relationships with all of our stakeholders and our provider relationships, particularly during the pandemic. We've also built relationships in communities and organizations where we didn't have a relationship, and we're now free to go to those communities and work with those organizations. We've enhanced how we provide data so that communities could understand the impact of the pandemic on Nebraska. And I tell you, I could not acknowledge Ashley Newmeyer and Katie Stromberger for their leadership on data from morning till night. We were on the phone about the data, and so I really appreciate their leadership. We launched Medicaid expansion, improved programs for the YRTCs. We now call it, Governor, Nebraska Yes, which means Youth Engagement Systems. And then finally, we continue to improve services for children in our foster care program. We were ranked as 9th in the nation by the Casey Family Programs. We are now 7th in the nation for child well-being. As I reflect, though, as your leader of Department of Health and Human Services, it has been an expansive year for me and for my team. I've had to be tenacious, at the same time be eclectic, more than I ever have in my career. But my personal commitment to this work and the work that we do and we stand for has not waned. Again, I want to thank my teammates for their patience with me, teaching me, helping me to grow and expand in areas that were unfamiliar. So let's talk a little bit about the 5th edition of the DHHS business plan entitled Many Good Deeds, Helping People Live Better Lives. You know, Rosa Parks once said, memories of our lives, of our work, and our deeds will continue in others. The pandemic has shown that many, many good deeds have been done through our fellow DHHS teammates, Health and Human Services professionals throughout Nebraska, and thoughtful citizens helping one another. This plan informs our key stakeholders, partners, and citizens on our top priorities, comprised in our DHHS four-pronged approach. Let me start with the first approach. The first approach is simply creating an integrated service delivery system. It contains 10 different initiatives and is the largest approach for this year's plan. It contains initiatives such as Access to Nebraska, the Family First Prevention Services Act. It embodies our foster care work. We also included Nebraska 988 project and the youth residential facilities. Our second approach is establishing and enhancing collaborative relationships with community stakeholders and policymakers. This approach has 3 initiatives, which focuses on collaborating to improve services. And such examples are, and we want to make sure that our constituents know that we're paying attention to being able to get timely license and certifications on time. So we've created a system to be able to do that. The second thing that we're going to be focusing on is a Maternal Mortality Review Committee, making sure that we look at the data that tells us about women who have a difficult time with pregnancy and what are the things that we could do to better support them. And then finally, which I'm very excited about, and I have worried Sherry Dawson to death, her behavioral health 3-year strategic plan, which has 4 focus areas that really focus on making sure that behavioral health is very inclusive. It provides the type of mental health services that are needed in the community as well as in our state institutions. Our small yet very important third approach is aligning DHHS teammates under our mission of helping people live better lives. It concentrates on one initiative of recruiting and retaining DHHS team members to ensure we can better provide high quality and efficient services to the citizens of Nebraska. And Friday, Governor, one of the things that we talked about as we talked about recruitment and retention, we want DHHS to be known as a great place to work. We spent a lot of time on that in our discussion on Friday. Lastly, the fourth approach contains 3 initiatives to ensure our internal processes and procedures are fine-tuned toward excellent customer service. This approach is enhancing the department's internal infrastructure to provide more effective, efficient, and customer-focused services to Nebraska. The 3 initiatives focuses on information systems technology in addition to our legal and finance area. And one of the things, Governor, I'm very excited about, we're going to hit that deadline that you gave me of April 30th, 2022 with our iServe project, which is going to allow our constituents to go online, apply for a plethora of services with one application. And we're very excited. Lori and I and the team have been working extremely hard on that. This plan represents thousands of efforts to help DHHS achieve our vision and transform services for citizens of Nebraska. Finally, and as I close, I reflect on the accomplishments and aspirations marked in this plan throughout the department as I embark on my 3rd year at the helm of DHHS. I must say with tremendous appreciation that I am truly proud of the resilience, hard work, innovation, and caring that I see exhibited daily by the work we do for and with Nebraskans. We have countless stakeholder groups that we partner with to accomplish our work, and I appreciate hearing from them and our citizens. We continue to work on initiatives that will personify our mission. And I am thankful to you, Governor Ricketts, and his team for his leadership, collaboration, as we serve each and every citizen of this state. And so I stand ready to answer any questions. And here is a copy of our business plan. It's excellent, well done, well written. It explains thoroughly how we plan to get the work done, and I've highlighted some of the initiatives in my speech.
All right, thank you very much, Danette. So there were 17 priority areas, is that right? 17 priorities, that's fantastic. All right, great. Well, thank you very much. Don't go too far away. Okay, because we're going to start with questions about your business plan. And Sarah, since you're the only press that showed up, apparently we're doing the press conference just for you. Seriously, it's all about you today. So, we will take questions from you on this topic and then any other topic you want to do. No pressure.
I'd like to know what goes into a plan like this. What kind of, how do you distill everything you're doing over the course of the next year into words on paper?
Danette, come over here, please, so we can get the microphone, because we still do have the NET.
Okay. Well, I think what we did, and it was led by Rick, we made sure that we looked at the most critical issues that needed to be solved for Nebraskans. As I mentioned earlier, iServe is certainly one of those. We want to make sure that our constituents have the opportunity to apply for benefits, for services, but be aware of those services that we offer and then be able to apply for them. So I think what we did was we took the most critical areas that we thought were critical to Nebraska, and those are the initiatives that we put in the plan. In the beginning of the plan, you will notice the areas that we think that we've had some really good successes. We talk about SNAP, we talk about Medicaid, we talk about our YRTC programs, we talk about behavioral health, and those are the areas that we think that we've accomplished. But in this business plan, which is different from the first business plan that I did when I first got here, we are now focusing also on the infrastructure of the organization. In order to have a department that functions and operates above board and professionally, you have to have a good infrastructure. So I have good general counsel, our human resources area, our IT area, our finance area are all there to undergird the department and make sure that our programs can be successful for the people we serve.
And I see that there's a couple of these that are continued from the last plan. And have you identified sort of what's stood in the way of reaching those initiatives in the last couple of years?
Well, sometimes it has to do with workforce. Sometimes it has to do with federal guidelines have changed, and so it may have morphed a little bit and made it difficult for us to achieve.
And don't forget to repeat the questions for
Oh,
the
that's right.
NET feed.
Yeah.
Specifically on the goal for recruitment and retention, do you know what positions have the highest turnover rates and what those numbers look like?
So the question is, for recruitment and retention, am I aware of what the numbers are for those positions that are turned over, right? Okay. Yes, we have a sense of the critical positions where we see turnover. Many of those positions have to do with some of our benefit support areas, our child welfare areas, some of our 24-hour facilities. We've seen quite a bit of turnover.
So those would be the targeted positions?
Yes, yes. And we're focusing on that in our recruitment as well.
You might want to point out again just what we did with regard to pay adjustments.
Yes, lots of pay adjustments for our child welfare staff and our nursing staff. We're beginning to see nursing applications come in, not as many as we would like, but we're beginning to see that. In our long-term care, in our youth programs, we're seeing more people coming in to be interviewed, and certainly in our child welfare programs as well. I do believe that the bonuses that we've received, the rate increases have helped us with recruitment. It's now selecting the right person to do the right job here in state government.
And I've seen the ads, or I've also heard the governor talk a little bit about, hey, we're not going to make you get vaccines at the DHHS. Is that, do you attribute any of the new applications to that sort of?
You know, that's still unclear.
Repeat the question.
The question was whether or not people who are not vaccinated, whether or not we're seeing applications from those folks that have not been vaccinated. Is that correct?
Yes.
Okay.
If you're attributing any of those new applications to those calls.
And the answer to that would be, I think it's too early to tell. We're still working. I think being able to work with us, not being vaccinated, but also with some of the pay raises that we've got, I think that that's going to help us be able to recruit.
I think our nurse applications are up about, I think Jason Jackson told me they're up about 15%.
Over, what amount of time?
From previous before. But I think Danette's also right. It's not only the part about the hey, we're not gonna make you get a vaccine, but it's also the bonus and the pay increases. So
Right.
it's kind of hard to pull those all apart.
And sorry, the 15% though was like over.
Prior to when we launched these different programs.
Yeah, okay. I think those are my questions on the plan right now. I might digest it and come back to the
Okay.
plan later for more questions, but I have other questions on other topics.
Absolutely.
Okay, and this may still have with this first one, I don't know. But the state averaged 400 people hospitalized with COVID last week, which is sort of almost at, if not over the 10% mark. I'm wondering if there's any sort of plan to maybe go back to the daily and more extensive data, or introducing those restrictions on elective surgeries.
Yeah, so with regard to, the question was, so our hospitalizations have been up around 400 or so, which is kind of the threshold to hit the 10% level we've talked about throughout the course of the pandemic. And that's the threshold where we start doing the daily data, and I believe that's supposed to be implemented today. Is that right, Dr. Antone? That is correct. So yes, that daily the daily data will start again today. And with regard to the ban on elective surgeries, we are not planning to reissue another DHM with regard to that. We think the hospitals have been able to manage it, with regard to their personnel and so forth. So we're not planning on doing that, but we will be going back to the daily dashboard, or updating the dashboard daily.
And the same data that was prior to this latest rolling down?
And I believe the data is going to be pretty much the same data. I'm seeing heads nodding yes. So it's going to be pretty much the same data. I will note, though, and correct me on this, folks, we're also going to be adding weekly data, or it's already on there right now, with regard to flu and RSM, right? So that's also going to be a part of the dashboard as well. RSV, sorry, RSV, thank you.
And totally different topic. You were in Germany last week. I'm curious if you went into that trade mission with any particular goals, and if you felt that those were common.
Yeah, so last week I went on a trade mission with our Director of Economic Development, Tony Goins, as well as Steve Wellman, who's our Director of the Department of Agriculture, and a couple of members of the team as well. And we met with prospective companies who are looking at investing here in North America and getting access to North American marketplace. And our person who runs the Germany office, Theo Freya, who used to work for Klaas and is now on the board of Valmont, did a fantastic job of setting us up with some of these companies that I think are really great prospects. Obviously, it's something that it takes time to develop the relationship, and also for them to make the decision about investing in the United States and where they're going to invest. But it was a very, very successful trade mission from starting those relationships. So I was very pleased how it all turned out.
Can you talk about what sort of relationships, or what companies or businesses are going to do that? Maybe you could see, I don't know, satellites here, or?
Right, so the question was, what companies in particular were we visiting? I'd rather not say those, because then they become targets for other people's, for other states to go try and get to those companies as well. So obviously, we're holding that information specifically, but it would be companies, and well, one company I could talk to you about is Klaas. So we visit with Klaas E-Systems, or the Klaas E-Systems, and some of the university folks from Osnabrück. And basically, again, just continue to develop that relationship. Klaas is a great employer here in our state. We really appreciate all they're doing. They just opened up their 20,000 square foot facility that is doing their training, kind of the ICAT, the Industry Consortium for Advanced Technical Training, which is their apprenticeship program based on the German model. It actually is the German model. If you get the certificate here, it's good in Germany. So that's one of the selling points that we use when we go to German companies, and Klaas has been very helpful in getting that set up here. So we met with them, and we met with other German companies. Generally, we're meeting with manufacturers, again, people who are looking to expand in the North American marketplace. So don't want to get into the specifics, but we had really great meetings. It was really a successful trip.
With all the conversation going on with vaccine mandates, I have one question on that. So you made it very clear that you're against the federal vaccine mandates that have come down, and I'm curious, I want to know if there's similar feelings about the state level requirements for, say, I know for students, there's several vaccines that are mandated before they can be enrolled in private or public school. And if you have different feelings about that, why?
Yeah, so with regard to the federal vaccine mandate, maybe I'll just give everybody kind of an update on this real quickly. Obviously, the Attorney General filed in the 8th Circuit Court, working together with Missouri on Friday, with regard to the OSHA rules. That's the 100-person or more employers. And we expect that the Eighth Circuit will get fully briefed on that this week and potentially could issue an injunction this week if they were so inclined. So that's within the realm of possibility. I would also note that you saw that there was an injunction issued in the Fifth Circuit Court over the weekend. That does not apply to our circuit, but is obviously a very positive sign that at least one of the circuit courts had said that there's enough here for the case that they're issuing the injunction, and I believe the U.S. Department of Labor has a deadline this week to be able to respond back to that before that injunction becomes then permanent. And so that's kind of where we are with the OSHA case. We've also got the case on Medicare and Medicaid that we're filing suit on as well here in the Eighth Circuit Court. One would expect that that would get briefed up maybe next week, and so we may have more information next week on that one. And then, of course, the third case that's out there is the one with regard to federal contractors. That one is also in process right now. I think it's with the magistrate. So those are kind of the three cases. Your question specifically about mandates for school kids. Again, I believe people should, make a personal choice with regard to their vaccines. We would encourage people to get the vaccines. When it comes to vaccine for kids, that's obviously a choice between the parent and the doctor. But again, I would discourage anybody from trying to mandate a child getting a vaccine that is so new. That this is, again, a personal decision. It should be done by the parents and the parents, the doctors they're working with, and not something that anybody ought to be mandating on those parents.
So I was asking also about the in-state law. There are some vaccines that are mandated for students already, polio, MMR. Right? Do you have a different feeling about those?
Yeah, so when we're looking at, the question is about, well, we already mandate some vaccines for school kids. You mentioned polio and measles, mumps, rubella, and so forth. And those, I think we have to remember that those vaccines that we are mandating right now in schools have had years, if not decades, of data for parents to absorb and for us to know the long-term effects on, right? So when we're doing those, and I'm going to go back to, mumps, for example, was the previous record time we developed a vaccine. That was 4 years to develop that vaccine, and it was done in the 1960s. So literally decades ago. So generations of parents have had the opportunity to be able to know, and we've had generations, decades to know what the potential long-term effects on kids would be. And while I encourage people to take a look at getting the vaccine, we do not have that long-term data for kids. And even though certainly appreciate that Pfizer and FDA have gone through the rigor to be able to do it, this needs to be a personal choice because we don't have that track record for this vaccine as we do for those other vaccines. And so that's why I think there's a difference and a distinction between mandating for some of these ones like polio or MMR versus what we're doing right now for the COVID vaccine, which I don't believe we ought to be mandating. We need to have the track record there to have the information to have time to disseminate and for the public to have time to digest it.
And at the same time, you're saying, though, that they should take a look at getting the vaccine.
Again, I would say that for the parents out there, they ought to take a look at what the FDA has published with regard to this and work with their doctors whether or not they think it's going to be appropriate for their kids to get the vaccine.
Those are all my questions.
All right, great. All right, well, thank you very much, Sarah. I appreciate you being here today. You're our star. So, and again, folks, I just want to, again, the other stars in the room are our Department of Health and Human Services. You all have done a fantastic job, especially through this pandemic, in helping keep Nebraskans healthy and helping Nebraskans live better lives. I couldn't be more proud of the accomplishments that you all have done. So, great work, team. Keep it up. Look forward to implementing this plan, Danette. It's a great plan, and we'll look forward to catching up and watching the progress you make on this plan. Thanks very much, everybody. Have a great week.